Yeah, Herbert Goodrich knew his older brother had prostate cancer, but never thought much about it when it came to his own health. That's until the hospital held a men's health summit at his church. Wanting to set a good example for his fellow church members, Goodrich got screened for prostate cancer. His PSA test came back showing signs something might be wrong. After further testing, he found out he had prostate cancer. After completing 5 treatments in the fall, Goodrich is doing well. In an OU Health interview, he says without taking that first scary jump and getting tested, he doesn't know where he'd be today.
A lot of men my age, especially me, I'm one of them that just said, man, I'm not thinking about cancer right now. I mean, if I go, I go. You know, but when I heard it and I actually knew that I had it, I wasn't ready to go. I encourage every man that's out there that's listening to me that it's better to know than not know. Because like my situation, had I not moved to get tested, I still would not have caught it as early as I did. So I'm grateful and I'm blessed to be able to sit here today.
We spoke with his physician, Dr. Kelly Stratton, who says the pandemic has had a huge impact on the number of men getting early screening.
We have seen the numbers of prostate cancer cases go down. We don't think that that means that we're stopping prostate cancer from happening. We think that this is fewer men getting tested, fewer men are finding prostate cancer that can be easily treated. And so the concern is as we look to the future, that there are going to be men who may have missed an opportunity to get treatment at an earlier stage.
Would you say that early screening saves lives?
Cancers that are detected earlier, it may be easier to treat them, and it may reduce the impact of prostate cancer later in life.
Goodrich is now just following up with his doctors. He still continues to encourage men, especially those at higher risk, such as those African American men and those with family history, to get early screening.